I'm not someone who runs out and buys the first thing that when it first comes out. I want to kind of see how it's going to be integrated, or if it's something that we would integrate with our practice. So, we currently have digital radiographs, which is great. That's one of the first things that we did. We more recently added a CT cone beam machine, which can take three-dimensional x-rays of the bone, sinus, and so we use that both for endodontics, checking for fractured teeth, surgical extractions, placing implants. So what that's enabled us to do is provide a lot of services that we didn't or weren't able to provide before, or even if we did, we would have had to send them out of the office to have the scan done, then come back to the office. Now we're able to take the scan, and even in the middle of procedure, if we want something, need another scan, they're able to just walk down the hall, have that done, and then go back and sit down. One of the things that we're in the process of adding right now is going to be a scanner. What that is so that we can take impressions without actually putting impression material in your mouth, which makes it nice because a lot of patients taking impressions is difficult for them. They either have a gag reflex or they have to sit up all the way. And once you put that in their mouth, it's in their mouth for 5 minutes or whatever, depending on what material you're using. So within about 2 months, we just ordered that at the convention, and after we get trained and up and ready to go, probably we're going to be able to eliminate about 90% of the impressions that patients have to currently endure. So between the scanner and the cone beam and the digital radiographs, hygiene-wise, we use something that's called a Velscope. What the Velscope is, it's state-of-the-art as far as being able to measure for precancerous lesions in the mouth. You can do a visual, but with the Velscope, it has a special light that we use, and we turn the lights down in the room, and you can actually see something subcutaneous. So in other words, you can see something below the tissue before it actually becomes visually apparent. So, and that's something that a lot of practices, the Velscope, the CT machine, the scanners, a lot of practices don't have that because it is an investment, but we always feel that it's important to stay on the top of technology so that you can provide the best service for the patients.